to handling these kinds of crises, that giving people options, a choice is key. So welcome to the CRI where you have choices. One, you can come up to the podium, not wanting to do that, speaking publicly. We have two forms of passive testimony. If you want to fill out an index card, which are available at the table in the back, and you can pass those off to the support volunteers in the back room. They will get those questions to me, and we can just read them off. And then also we have an online form. So for those of you who are participating via Zoom or are here and have your device and you want to, you can go to the QR code that is going to come up on the screen soon. And there's also a shorter bit.ly link that you can use. And fill in whatever information you want there. If you want your name to be shared, you can put it in there. If you don't need to. And just write in your question. You do one question per submission, so it makes it easier to keep track. So 3 ways to provide testimony or ask questions. Start now, putting those in, and public testimony will try to fix it. I also want to thank Honouliuli Hawaii and Mutual Aid Probably for the food. We have Chinese food tonight. Thank you very much. Yum yum. Let's see what else. Oh, I want to also welcome our newest CRI member, Mai K. Hall. She's attending online, and we'll go through and do quick introductions in a minute. But she was elected from the nominations that were turned in that were announced last meeting. And this is also, I guess, a good time to say that we have 4 new openings coming up in September on the CRI. A way to have healthy transition. And so if you are interested in perhaps serving on the CRI, please go to our website. We have a Google form to submit nominations. There are 4 seats that will be open. One is a directly affected community member. One is an organizational representation seat. So if you are a volunteer or staff with an organization that works on issues related to water quality, you can apply for that seat. And then we have 2 at-large seats that will be open. And the deadline for submitting nominations for those 4 seats will be August 12th, right before the August CRI meeting. All right, I think that's all the things. Good. All right, so let's go through and do quick introductions so everybody knows who everybody is. Marty.
I'm Lacey, CRI member representing the impacted community.
Aloha, I'm Melody Aduma. I represent an organization which is the Environmental Caucus of the Democratic Party.
Yay!
Susan Bourne-Kay, at large.
I'm Walter Shannon, CRI representative for the general public.
And then we can go online. Ilima.
She's muted.
1 second.
Aloha, Ilima de Costa, representing Oahu at large.
Thank you. Hialani? I think Hialani might be frozen.
Oh, my name is Mai Hall. I'm representing the Native Hawaiian seat. I'm also an elected family member.
Thank you very much, Mai. And then Hialani, I don't know, I think you look frozen on our end. So maybe you should call back in, but Hialani is the other Native Hawaiian seat. She's off island right now, and I appreciate her taking the effort to attend. Okay, and additionally online, we have representatives from the EPA. Someone want to start with introductions? Maybe Jamie or me? Sorry, I forgot Mandy Pint, who is also a directly affected family member. Should be right there.
I can't hear the room, Rosalie. I can hear you. Can you hear me?
Yes, we can hear you.
Aloha, this is Mandy Find. I represent impacted families and an impacted family myself, calling in from Virginia tonight.
Thank you. And Kimo David Kimo Frankel, and he's online. Oh, he's not here. Okay. Okay. Okay, we can go to the EPA. And it appears like they can only hear you, Rosalie. We need to double check that they can hear the room.
Can folks hear Marty?
She's a little garbled. This is Amy Miller from US EPA.
Hi, Amy. Thank you for joining us.
Right, but how do we count out the sound again?
It's coming out through here, so it's coming through my. Warren, do you want to try your direct audio?
My direct audio?
Yeah, you want to try your audio?
You just turn me on, and then it should.
Okay. It says it's connecting to audio, so that's why.
Oh. Okay, I'll connect totally then.
Sorry, we're trying to fix.
Okay, now it should be going. Tell me if I'm on.
Is that better?
Try yours.
It should be on now. Is it on?
You're muted though.
Can you unmute me?
The only thing we can hear is through Rosalie's audio. When Chen mutes.
Yeah, so every time you speak, I have to unmute you manually, so that's why if there's.
Am I unmuted now?
No, try again.
Okay, let me try again. Hold on. Can I get in there?
Marty, try speaking again.
Okay, test. Can you hear that better?
Jamie, you're not. Can you clarify?
I don't know why it's on this.
We can hear you, Rosalie. That's about it.
The speaker is right here.
There I'm on. But it echoes.
But there's something there.
I can try again.
Yeah, Warren, you just.
Yeah, that's me unmuted.
Okay.
You would have to turn down the volume on the TV.
I see. Okay, 1 second. Okay, try again.
There.
Can you guys hear us now? Okay.
Test, can you hear me?
Test.
Can you hear me?
Can you hear?
Yes.
Okay, peace of God. Hallelujah. Thank you very much, tech wizards and chaos fairies, for being fairly up on us. Okay, EPA, would you like to introduce yourself?
Hi everyone, this is Amy Miller. I'm the Director of the Enforcement and Compliance Assurance Division. Jamie?
Jamie Iroquois, I'm the 2023 Consent Order Coordinator. Allison?
Hi everyone, Allison Fong. I'm the Assistant Director in our Land Chemicals Redevelopment Division over the RCRA programs. Matt?
Hi, Matt Cohen. I'm the 2015 AOC Project Coordinator. And Claudia?
Hi, Claudia Espinoza. I'm an environmental engineer in Region 9 Stream Water Section. Thank you. I think that's it for EPA.
Thank you very much. Thank you very much.
We do have to.
Oops, sorry. Sorry. Jamie, will you?
I was just saying we have a couple folks in the room there that might want to.
is Sharon Davis. I'm the Community Involvement Coordinator for EPA. Woo!
And I'm Alejandro Diaz. I'm the press officer for EPA.
This is facility closure.
Thank you. Okay, we can move to the first agenda item, which is the water quality reports from the Board of Water Supply. Susan, can you pass this line?
Good afternoon, everyone. Madam Chair, CRI members, and everyone in the audience. My name is Erwin Kawata, and I'm the Deputy Manager for the Board of Water Supply. Also with me here today is Ron Fenstermacher, Acting Program Administrator for Water Quality Division, and Kirk Yomoto, the head of our chemistry lab. So today I just wanted to just quickly go over our water quality report. This is a report that we publish once a year. It's required by the regulations. It's designed to tell you where your water comes from, what was found in that water, and how what was found, how those values compare to the regulatory standards for safe drinking water. So what we have here is just a sample report that we distributed hard copies here in the room. We also have extra copies back at the table for those who like to copy. And then we have online, on the screen for those online, that we're going to use this as a sample. So at the very top, and I'm just going to walk through this very quickly so that you know how to read the report. So at the very top left corner is showing the location that this report applies to. Just below it is a table that shows where the water comes from. So in our case, we have a number of wells, shows you the name of the well and what kind of water it is and whether any kind of treatment is performed. Right below that table is what's called the primary drinking water standard. All those regulated contaminants and what we found in them, and how those levels that we found compared to the standards. To the left of the page, at the very top, is contaminants that are not regulated or unregulated, what's called unregulated contaminants. The same thing, what those contaminants are, how much was detected, and how those values compare to any kind of health advisories that currently exist. Now, the drinking water regulations require testing at the water source. It also requires testing in the water distribution system. So this is the pipeline network that carries the water from the source to your house. So right below that table on the right-hand side is the disinfection byproducts that we're detecting. Now, the rules require us to monitor for disinfection byproducts. You know, these products are formed when you add chlorine or other kind of disinfectants to the water. And again, what those disinfection byproducts are and how those levels compare to the standard. Right below it, the results of our microbial testing performed on our water system. Below that, the kinds of residual chlorine values that you can see. And then at the very bottom on the left-hand side of that table is the lead and copper rule test results. These reports are sent once a year. We also have them available online. So the rules require that for those water systems that serve more than 100,000 people, you have to make it available online through a searchable database. We already do that for our entire water system, regardless of size. So if you are receiving a Board of Water Supply water bill, you can go online. You'll get that report once a year. Or you can go online, enter a street name, and get a report for anywhere on island served by the board. Okay? With that, I'm happy to take any kind of questions.
I got a question.
Hello. Okay, so I'm sorry. So the data that's shown here, is it based on a series of report of samples or samples taken from?
Yes, all the data here is based on testing we do throughout the entire previous calendar year. So that's what this is based on. So the previous January to December testing that we do for all of our water sources, all of our distribution systems, that data is reflected in this report.
Yeah, I had a kind of two-part question. On the section where it talks about the unregulated contaminants, in the parentheses it says, they have limits, but they do not have limits, but they require monitoring. Could you, that's part one, could you explain why that is? And then part two, if you could use one of them as an example, such as the chromium, to kind of explain what that is.
Okay, so I can take a chromium is on this particular report, it shows hexavalent chromium. It occurs naturally. It is something that we're conducting regular testing. It was something that was started or required to do a long time ago under what's called the information collection rule, and we just chose to keep doing the testing so that we can provide long-term information for individuals so that they can see what their levels are. Now, the other main point here is that the report shows what was found in the water. So the rules regulate somewhere in the neighborhood about over 90 different kinds of different contaminants. So of that, you're not going to see some here because we didn't collect it.
I know that for sulfate in the unregulated contaminant section, it's kind of high based on the health advisory.
In the sulfate, in this particular example, the sulfate amount that was found ranged from a minimum of 19 milligrams per liter up to 23, and health advisory is 250.
Oh, I see.
So that's how you reach it.
Period,
Right?
not,
So
I thought it was 19,000. I
no,
was
it's
wondering.
19.0.
Thank you, Carmen.
Yeah. So what we're showing is what the lowest is, what the maximum is, and what the highest average is for all of the testing of those water sources shown on the far left. So that's what that represents.
Thank you very much. Yeah.
What is region? What area is region 3?
Well, there's a map that goes corresponds. So we have this with this report. We attached an information booklet that has additional supplemental information, including a map. And that map is subdivided into different parts. And in it, it will show you where region 3 is, and I'll give you an idea of where that water source is located. There's a map over also.
Okay, so just for the people that live in this room, the Kapilina water system is not part of this.
No, this is only Board of Water Supply. So Kapilina has its own water system. It's served by the Navy's water system. Navy is also required to do the same type of report and make it available. So for us, what we do is we send the report to every one of our customers on file. Now, you can get it online. You can make that notice to your customers and say it's available online. But some customers may have trouble, using computers, may not have internet access. So to ensure that everyone gets the report, we mail it to each one of our customers. So we're putting out about 174,000 reports every year.
Erwin, given the new reality that we live in with contaminated water, would it make more sense, or is it even an option to do this kind of testing and reporting more frequently?
The EPA regulation, Consumer Confidence Report regulation, has recently been revised. And now, starting in 3 years from now, you're going to have to get the reports twice a year. You'll get one in July. This report is done sent out in July. But now that new rules will require one in July and one in December.
Thank you.
Jim, my name is Melody. Aloha, Erwin. I looked at your report. It is disclosing that you did look at Cuneo Wells 1 and 3. About a year ago, we did investigate Cuneo Wells 3 and 4. Apparently there were findings of PFAS. I don't see anything of that nature on your report. And since the EPA has come down now to very very strict standard of PFAS. I'm just wondering why is it not considered in your report? And I'm actually surprised that you have it on your well, if I thought that was private versus board water supply.
In Cuneo Well, the board has our own Cuneo wells. Again, the reminder, this is reflects the testing done in the previous calendar year. So the data that we collected in that year didn't show it, so it doesn't show up. But going forward, there are rules that require us to do PFAS testing. Those results, when they come out, are going to show in subsequent reports that actually have to come out later on. Now, in Cuneo, there is a private water system. It doesn't belong to the board. We had PFAS that was found. That system was, the sources belongs to the Army. But for the board's water system, yes, we do have wells in Cuneo as well.
So in subsequent reports, it'll be.
It could be there if we find it, that's right.
Thank you.
Hi, thank you for coming. This is really interesting. So I'm noticing that 3 of the 4 wells have GAC, the filters. How do you decide when to put a GAC filter on?
All of these wells here that are listed are in Central Oahu, and they all have been affected by pesticide contaminants or pesticide or agrochemicals that was once used as pineapple cultivation. So all of the wells there, Waipangu, or Cuneo wells, or Iulai, all of those have those trace, what is called trichlorpropane. And so there is Department of Health regulations that sets limits. If it's above that limit, we stop activated carbon.
And then how often are those, what's the rules on when you switch those out?
Well, the water is continuously filled with activated carbon. And we do regular testing to check on the carbon and the performance, and when it starts to, at some point it reaches saturation. In other words, the carbon cannot hold anymore. When we monitor, we reach that point, we do a change out of that carbon.
So this monitors on the GAC?
We actually go out and collect water samples and do the testing.
Thank you. We're just wondering, because you just said that you, board water supply, you do your own testing. Because to our understanding, the state does not do its own testing. It does go to the mainland, to Oregon, and believe in Oklahoma. So how is it that the Board of Water Supply is able to do their on-island testing?
Well, Melody, some of the testing that we do ourselves, but there are a number of contaminants that's regulated that require monitoring that we don't do. So we actually do send our samples out to contract laboratories on the mainland also. Okay.
What's the turnaround time for those?
It varies depending on the contaminant. So some of the more complex ones can take about 2 to 3 months. Some of the more simpler ones can take less than that. The monitoring schedules are varied depending on the contaminant, how much you, whether you find it, and it can be either quarterly or it can be annually. In some cases, it can go once every 3 years. It's based on how often you find it. So for many of our contaminants, we don't find it. So we're on once every 3 years testing. For some contaminants like these pesticides, we know it's there, we're treating it. So we're doing the monitoring internally by us, and we do it more often just to check activated carbon performance. So it varies depending on the contaminant.
Based on the Red Hill contamination, do you anticipate changing Board of Water Supply's approach in any way to this kind of testing?
Well, as far as Red Hill is concerned, we are doing testing of our wells that are in close proximity to Red Hill, and we're doing it on a weekly basis. And we're going to continue to do that. We've done it ever since 2014 when the leak first happened at tank number 5. And we've actually increased the frequency after the November 2021 incident that happened at Joint Base Pearl Harbor. So we have a number of wells that are what we call 5 well stations that are in close proximity. As you know, 3 of them have been shut down. Palava Shaft, Palava Wells, and Aya Wells all have been shut down. So we continue to monitor those even if they're shut down. We know groundwater is moving and we want to check on whether we're seeing any kind of contamination with that groundwater movement.
How is it going? Do we see contamination?
So far, so good. In terms of we haven't been detecting any kind of petroleum contamination, but very recently we actually detected PAHs or polynuclear aromatic hydrocarbons in our IAO well.
Okay, say it slower. What?
Polynuclear aromatic hydrocarbons.
It sounds awful. What is that?
It's a complex chemical that can be present in fuels. Yeah? And so we actually found it in our IAO wells. We actually had a single incident. We reported the data, and we actually have that data on our website. So you can go on our website. We have a letter that we sent to the Department of Health and EPA. We reported all the numbers that we found, and then it's available so you can see it. But IAO wells right now is shut down.
Okay. Yeah, that's what my mom.
Yeah.
Yeah.
So it's not serving any water to our system.
And is your theory that this polynuclear thingy comes from the Red Hills Bill? Like
Well, at this point, we don't have enough data. We think what that data really says is that number one, it's important to characterize the nature and extent of the contamination at Red Hill. Study the groundwater, study what's kind of contamination there. That's some work that the Navy and in collaboration with the regulatory agencies have been doing. And it's ever important to get that work done so we understand, that movement and the extent of the contamination and how it's actually moving, if at all, the groundwater. That's number one. Number two, monitoring is essentially important because you could actually find something and not know. So, in the case of IAOL, we just happened to collect a sample and we actually detected. Think about if that well was actually in service, that water would have gone into the water system. So it really demonstrates for us the importance of, it actually reaffirms the importance of shutting down Halawa Shack. Until we know where that contamination is moving, the nature and extent, that's so important. Until we can know that, we're not going to be turning on Halawa Shack anytime soon.
Thank you. Last question then. Heilani has a question and Nicole. Wait, I have on this particular question, if people are concerned, how do they stay up to date? Will you post an update to your website, or will you distribute information in some way if people want to keep track of the development of this?
Well, you can look at our website. We post all of our laboratory reports on the website. If we do have a situation, like in the case of IAO wells, we will notify the regulatory agency and take the steps thereafter as to what the regulatory agencies prescribe. We will do it. But because the wells is shut down, it's not a concern. But if there's questions, certainly people can email us, they can contact us if they have questions. Take a look at our website. We post the results there.
Thank you. Okay, I'm going to go to Heilani online.
Thank you, Erwin. I have a question. My question is that spreadsheet you showed us, is any of those things like the fluoride and the any of those substances that are detected in the water, are any of them naturally occurring?
Yes.
Like can they come from some kind of natural occurrence? That's my first question. And then the second question I have is, and if so, which ones? And then the second question I have is, do you folks always do your own testing? Do you ever rely on Navy's tests, or do you always make it a point to do your own testing? Thank you.
Okay, thank you for the question. First, some of those contaminants do occur naturally, like fluoride, for example. It occurs naturally. The levels that are shown there are all compliant with the standards, and so they are very safe to the amount that's present there, number one. To your second question, We do all our sampling on and testing on Board of Water Supply as well, and those results we make it available through this report. Hopefully I answered your question.
Erwin, just for clarification, is the Navy pipe system connected to your system at any point?
We do have what is called emergency connections between our system and the Navy's water system for specific places. All of those connections are right now valved off and disconnected. And we only connect it when there is the Navy's experienced an emergency, and then we actually make that connection and turn the valve on. We also have in there what is called a backflow preventer, which prevents anything from the Navy